morning. Welcome to Viewpoint, your program of personalities, politicians, and perspectives. We're going to have an interesting perspective if our guest doesn't show very quickly here this morning. He's on the road. I hope he didn't have any trouble getting here.
I hope not.
Well, we'll muddle along and come with something.
You just have to, if you have to be on the road today,
take it easy.
Think.
Yeah, take it easy. First thing we do, kudos. Interesting thing in the paper, of course, we've known about it, we've read about before. But a gentleman who's worked for a firm, any firm, for 50 years and retired ought to have some recognition. And Grau, Chevrolet, Buick, Cadillac folks are going to give Ron Zerkheimer some recognition. But there was a little crib in the paper this morning. And I thought it appropriate, Judy, that we might take a minute or two and just tip our hats in the direction of Ron Zerkheimer. That shows a lot of ability to stick to it. And the fact that he started as a young man, 19 years old. And by golly,
that is a young man.
Yes, it is. And
I got grandkids older than that.
Well, kudos to him. And good morning, Don. How are you this morning, sir?
What do you think of the weather, Mr. Cavi?
Oh, it's just beautiful out there.
No, it really is. It's very pretty.
I wish it was like this on December 24th.
Yeah, really. I think we all do.
Well, we're already live on the air, Don, so yeah, we have plenty of time. Don't worry about anything, because nothing's all right.
I'm just glad to be here.
Yeah,
I'm glad you're here.
Thank you very much. Thanks, Judy.
Before we bring Don on, we got some interesting. Don, of course, Judy will make the formal introduction in a minute. I just saw something that came across my desk not too long ago about expenses of the administration out there at 1600 Pennsylvania Avenue and a place called Foggy Bottom. All of the first ladies, with two exceptions, all of the first ladies going back to Jacqueline Kennedy, and that's as far back as this went, they had, with the exception of two, had only one secretary or personal assistants. The current one has 22 personal
Boy,
assistants.
she must do a lot of writing.
22 personal assistants.
You have that many, Mr. Cavi?
At a cost of, let me get this here, over $2 million in annual salaries.
Oofta.
For personal assistants for the First Lady of the United States.
Now, I think I can explain a little bit about
that.
Try. Well, that's how they do it in Chicago.
In Chicago, well.
And Illinois is learning real well from them. Tax and spend, tax and spend, tax and spend.
Well, that's what she grew up with. But anyway, that's amazing. 22 assistants. I was, well, one to comb her hair and one to do her nails and one to open her mail and one to read her mail to her. It's incredible. Just absolutely totally incredible.
Boy, that's a real division of duties.
Yeah, it is. Anyway, why don't we get down to business? We have some serious health problems in this county. And so let's talk with our gentleman. Why don't you introduce him here?
Yeah, Don Cavi is the administrator at the Logan County Department of Public Health.
And we appreciate your being here, Don.
Yeah, thanks. It's always a pleasure to be here.
Since we were on money here for just un momentito, how are you faring?
Well, we're hanging in there.
Not well.
Yeah, could be better. Let's put it that way.
You're not exactly rolling in it. Huh?
Yeah, I know. Without a state budget, over 40% of the health departments statewide are really feeling it, and we're certainly one of them.
And that's on the line. That's at the bottom of the barrel, taking care of people. That's a very basic need that people have to have.
Yeah.
Now I saw the state of Illinois owes the city water, light, and power down in Springfield $10 million. Mm-hmm. That's just unconscionable. Yeah. I don't care how big city water, light, and power is. Nobody should have to carry that kind of an indebtedness because the people can't pay. Yeah. So, at a more specific level, and right here in Lincoln-Logan County, you're facing real budget crises.
We are. We've made some adjustments at the department. Right now, we have had to cut our services back a little bit. We're operating Monday through Thursday and then Friday till noon now, which it is a cutback, but yet we feel it's necessary to maintain our financial viability to, cut our hours back, but we're still operating at 90% of our normal work hours. So, individuals that need to come in and have services at the health department, we're still quite available. So we did make that adjustment, and the employees, I have them taking furlough days, including myself. So we're taking about one every quarter right now. So it is helping a little bit to ease back the pressure on our budget.
Just because I don't understand anything about it, may I ask you, please, what does that do to your employees' retirements, their IRA, and so forth?
Well,
and vacation time.
And that's a good question. I've been told different things. We're on the IMRF system, but I've been told that it shouldn't affect, but I've been told that it will, and I really haven't researched it. My thing is I want to try to keep this. Hopefully, we'll get a budget passed soon, and we can get things back on schedule. Because if it is in fact going to impact anybody that's ready to retire, I want to try to avoid that as much as I can.
I did understand recently. Somebody was telling me that what they're going to do is wait until after the primary and then vote on it. So that way, none of the legislators will be affected in the vote by their vote on the budget. So that's nice that they see why they're only, but leave everybody else's hanging.
Carnival
that
games
makes sense. Yeah,
carnival games, which cup has the ball under it?
Yeah,
sure.
Mix and match. Serious question: with the budget problems, are we in danger, or perhaps have we lost? And I hope not. Good employees that had to find another job?
At our agency, thankfully, no.
Good.
We have a lot of the people that work at our agency really enjoy working at our facility, but they not only enjoy it because we provide a good environment, but they enjoy it because they're it's public health. It's what they do. It's what they love to do. It's serving people.
Well, it shows too when you're in there. We just go in there and get shots. Period. You don't have any other need for the services, but that's a pleasant experience.
Good. Yeah, and I know we have our nursing staff is wonderful. Mary Anderson and the group in our clinic do an outstanding job. We have a new assistant administrator, nursing director, Kara Davis, and she's been really wonderful. So it's really a credit to the group of people that work in our clinic. They do an outstanding job.
Well, they're very loyal because a nurse can write her own ticket pretty much.
They can.
They don't have to be in public health.
That's true. Like I said, public health is just something that's in people's blood, and they enjoy doing it. And it's the clients we work with, and a lot of them don't have access to the vaccines and the health care, and health department's a great place to get that. So we have a lot of great things that are coming down the pike too that we're excited about. Now that, as you know, the Medicaid has merged in with all these managed care companies, we are now taking insurance cards. And so anybody comes in, if they're on Medicaid through Health Alliance or, Molina or one of those companies, Blue Cross, they can bring in their insurance card, and we would bill Medicaid directly. But if someone's on private insurance through Blue Cross, Molina, Health Alliance, we can actually bill directly now to their private insurance company, which not only will that make immunizations more accessible, but it'll help the people that are on private insurance. Maybe they don't have time to schedule an appointment to go in and see their doctor. They can just come right over to the health department, give us their insurance card, and we'll bill them direct, which is much simpler than back in the days when, they had to pay cash for that, and then we would give them a receipt and they'd send that to their insurance company. They'd have to process the claim on their own with the insurance company. Yeah. So it's more of a convenience now. So And with the whole integration of Medicaid and managed care, and that's kind of put us into that position where we're doing that now. But it's great because, like I said, we're more convenient now for everybody.
Mm-hmm. Well, if anybody has any further questions about the health department and insurance, 648-5510, right? First time I've said that in 6 months.
Wow, you're a quick study.
Since we're talking vaccines a little bit here, I made a note to self here to ask you about the shingles vaccine. I don't know whether you mentioned that to me or I made it up myself.
No, we do. We offer the shingles vaccine,
right,
and recommend it for people that are over 60 that have have had the chicken pox, and
which probably includes.
About anybody.
If you're talking about people over 60, that'd be right across the board.
Yes, and we do bill insurance for that. So, but anybody that wants more information, they can contact the health department. Our number 735-2317. And that is something we just started doing last year. We started carrying that. So it's been a real convenience for a lot of people.
Yes. I always thought when I was a youngster that the reason they had kindergarten was so you could get the chicken pox and the mumps and all the things and get them out of the way before you started real school.
Yeah, that is an easy way to pass it around. These kids are getting,
Yeah, of course.
As I say, ad nausea almost.
Yeah.
Those are the days when they put a red card on your house, said that you had whooping cough or measles or whatever.
Yeah,
and the house was in quarantine, and Daddy had to live somewhere else if he was going to go to work every day.
Yeah. Just the other day, there was something on the news about a high school where they had a young man who had the mumps. So apparently mumps are still going around, even though you've been talking vaccine.
Oh yeah, it's. We really encourage people to make sure they have their vaccines. We had the measles earlier last year, and that was a big scare. And I know, especially with the university kids. So we're really always promoting. Make sure your kids have their vaccinations, and we hear all these stories about how the vaccines causes autism. Thank you. And scientifically, I've never seen any evidence to suggest that it has, and fortunately, there's been some legislation that passed last year that because of the measles outbreaks that occur, especially up in the Chicago area, that makes it a lot tougher for people to get exemptions for not getting their children immunized because some people for religious reasons or whatnot, and now they have to go through a whole certification process to make sure their kids don't get immunized. Basically by making them go through more hoops, it just makes it a little more difficult to keep your child from getting immunized. And I think it's a step in the right direction because we really need to make sure that people get their shots.
Well, it's really, I think, just a tad narcissistic for a person to decide against inoculations because they aren't thinking about the other people that you could expose.
That's true.
Yesterday, I learned that if you have the pneumonia vaccine, you're good to go for the rest of your natural life, whatever that entails. Yeah,
and I really don't have the answer for that. And if I had Mary Anderson here with me or Kara Davis, they could probably give you a better answer on that because they're more of a clinical, absolutely. But I do know it is. We offer it, and it's a good thing to have.
Yeah, well, they really recommend it for people. I think it's over 60. So
if I ever get there, I'll better talk to them.
Well, yeah.
The other thing is we have the flu vaccine still available at the health department, and for people that don't like to get vaccinated, we do carry a mist, which is an inhalant, which is serves the same function.
And better late than never, really.
Absolutely.
Yeah.
So. If you don't mind, too, I was going to tell you we have some other exciting things that are happening at the health department.
Please, just interrupt me at your leisure because I just rattle on.
No, that's okay. That's okay. But we are going to be teaming up with Southern Illinois University, their School of Medicine, and matter of fact, our board just approved it a week ago, and I've been in contact with SIU, but we're looking at opening primary care clinic in the health department, and SIU will be. That'll be an SIU service that will be there, so we're looking forward to partnering with them because that's the one thing. There's a lot of people in this community that don't have access to affordable health care. Or maybe they can't see a physician. Their physician maybe doesn't take their insurance. And I know the doctors they're great physicians we have in the community, but they're pretty maxed out with patients. We have the university here, the college here, and the students. Maybe if they become ill, they need to see a doctor. We don't have an urgent care in the community. We do have the emergency room at the hospital, but this would be an opportunity to introduce all those into the community, and to have public health, primary care, and dental both under one roof. It's going to be a major deal for us. And we see a lot of people at the health department. They come in for their vaccines, and maybe our nurse will recognize that, well, have you seen your doctor? You might want to get this checked out. Mm-hmm. And we've had cases where people have said, well, I really don't have a physician to go to. Well, this is a great opportunity because we will have one in the building, courtesy of SIU.
A huge void that's there for a lot of people in Logan County.
Yes, and we think it's going to be a huge advantage, and that we feel people are going to take advantage of it. I know SIU does too. And in addition, they're going to be taking over the management and operation of our dental clinic, which we think will be an added plus. They're a federally qualified health center, and they are entitled to higher reimbursement benefits for the services they provide, whereas we, as a non-FQHC, that is the health department, our dental clinic reimbursement is not. That's the one thing the state does not reimburse well for, is dental for people that are on Medicaid, and so this will be a big plus because SIU at least has that advantage. And we have our dental clinic serves nearly 20% of the community of Logan County. We have over 5,000 patients in our dental clinic, and
is that right?
In our dental clinic.
In our dental clinic, yes, that's correct.
Holy Friday.
And perhaps of that 5,000, perhaps a significant percentage of them would not be able to see a dentist under normal circumstances.
More than likely, because our goal is to serve the underserved and the people that are on Medicaid that need to see a dentist. It's hard, not only around here, but around the state, to find a private dentist that's going to see them, and because they can't afford to see these patients. And like I said, because our reimbursement is so low, but as an FQHC, SIU will get entitled. They are entitled to higher reimbursement rates, and they qualify for that. So I think it's going to be a huge advantage. I think SIU will do a wonderful job, and we're really looking forward to partnering and having them under our roof. So that's something we're going to start working on here in the next month or two. They've got a lot of irons in the fire now, but we're going to be working throughout 2016. Hopefully we can have their presence in the health department either by the end of the year or the very beginning of 2017. So we're pretty excited about that.
There can't be a whole lot of health departments in the state of Illinois that will have such complete service.
You're right, Judy. There are some health departments out there that are FQHCs, and they do have that, but they're few and far between. So we're blessed, and we're fortunate that we'll be able to provide, those three areas: the public health, the dental, and the primary care under one roof.
Will they be sending MDs or interns?
We haven't discussed that yet.
Interns are good.
And they may even just send a nurse practitioner or a physician assistant, because they can write scripts for people. So we'll discuss that with them. And another thing we have under our roof is a wonderful home health agency that people don't realize. And incidentally, our home health agency won an award again, the second time in 2 years, a FASI award, which is FASI and Associates is a Patient Satisfaction Quality Assurance Association. They're a national organization, and they rank home health agencies if they fall within the 25 percentile of patient satisfaction, and we achieve that again. So Melody Crabtree, our the coordinator in our home health, and her staff do just a wonderful job there. And I always try to push the home health as much as I I can. We offer the full gamut: the nursing, the skilled nursing, non-skilled services, the physical therapy, occupational therapy. So they offer a wide variety of services.
It's a wonderful service. The people are
WLCN
wonderful.
offers a wide variety of services too, because we have a wide variety of sponsors. And one of the reasons that we have Don in here is we have some sponsors. So we'll acknowledge them right now, and then we're going to come back. That's great news you were discussing, Mr. Cavi. We appreciate that, getting that information. Go right ahead, James. And right back live in the studio here at WLCN. The program is Viewpoint, of course, operating each Wednesday morning at 08:15 to 09 o'clock, or somewhere plus or minus either side of that.
It's not real tight.
And our guest this morning, representing our wonderful Logan County Health Department, and they do a great job out there serving a lot of people who have a real need. Mr. Don Cavi, he's the entrepreneur executive out there, for want of a better term.
Whatever you want to call me, I'm
right.
pretty easy about it. So
one of the things I was sitting here thinking about, Don, and particularly in the medical field, political correctness, which is almost a painful thing to say in 2 words, because it's such a pain in the derriere. But there are some good things that come out of that, privacy and so forth, as regards a person's medical history and so forth. But I had an interesting thing yesterday. I was visiting a fellow over at St. Clair's, and a nurse came in to do his blood sugar work, which they do 4 times a day to him. And he wanted to know what it was, and she said, "This, can I tell him in this fellow's presence?"
Oh, yeah.
Political correctness. Mm-hmm. It's just run amok.
yeah.
And do you run into a lot of problems with that over there in the daily course of running the Logan County Health Department?
Well, we have to be real careful about
I understand privacy.
Do. Absolutely,
Yeah.
Right. So our nurses and our staff are trained every year. We go through some sort of training, but you're right. We do have to be very careful about that, and and the laws get more stringent year after year. And that's just something we have to really keep our eye on.
This is maybe a little aside, but they've been talking since we're electioneering about gun control, and they said that anybody who is having emotional problems probably shouldn't get a license. How in the world would you ever know someone's having emotional problems? Because of HIPAA, you couldn't tell anybody that. So how are you going to crack that egg?
Yeah, and that's a good question. That's a real good question. And I wish I had an answer for that.
Well, so are the politicians.
Absolutely, absolutely. And that's one thing. You bring up a good point. Mental health. That's statewide, and that's been a real concern with public health departments. Is there's really not a lot of resources out there. That are readily available to serve people in the mental health capacity. And I know that's something. Hopefully down the road, we're going to try to look into more, and as not only as the health department, but statewide, to see, what type of better mental health services we can provide for people, because the need is out there.
Don, do you see your staff see people come to Logan County Health Department with addictive problems?
It's something we don't treat.
And what are their names?
Yeah. You don't want to do that. Exactly.
No, sir, I don't want to make light of that. That's a serious problem for many people, and I do not want to make light of
Bill,
that.
It's something we don't really, because, not being a mental health agency, obviously we don't, but we do get a lot of people that do call us about, where do we send people to, and we're a resource at the health department. So our nursing staff, they know, what agencies are out there. If somebody has an addiction issue, who we can link them up with. And it's interesting you mentioned that, because, I believe our health educator was here last week. Emily Hodder was here to talk, and she may have talked about some of the heroin issues that are going on around the county. And that's something that we're real concerned about now. I know she plans on meeting and spearheading a group of community group, and they're going to meet next month to try to decide, what type of plan of action should we take to try to reduce this threat? Because, there's just been a lot of people, we read about the paper every week about somebody who's overdosed on it. And, so it's a real tough issue. It really is. It really is. And so we're hoping that this year we can address this with community leaders and, hopefully make a positive impact.
Did you know that there was a time here a few years ago that the Logan County Department of Public Health was responsible for the mental health treatment in this county? And the county board, in their infinite wisdom, decided to split that off. And they won. So you don't have it anymore.
Yeah, and a lot of it's funding, because we're a funding based. A lot of what we do is not only our fees, but a good chunk of our operation depends on our grants and funds through state or federal grants, and without state grant dollars right now. But again, the mental health dollars they're hard to find, and that's why mental health is such a challenge nowadays. And hopefully there'll be more of a priority given to mental health, and maybe the grants, if we push for that, then who knows, maybe some grant dollars will be available, and we can have some kind of an impact in terms of mental health. So
your fellow administrators, all from Cairo to Rockford, all over the state of Illinois, would be great circus jugglers, because you constantly have the ball in the air, juggling this or juggling that, trying to find. You mentioned the word grants. Thank God they're out there, but and knowing where to look for them and applying for grants, writing for grants is a state unto itself. State of the art, somebody has to, if somebody wants to get a grant from Eaton Corporation, for instance, that has to be prepared properly and presented to them.
That's true.
It's an art.
Yeah, that's true. And we have some standing grants, and right now that's what we're waiting on. Once we get this budget signed, a lot of state standing grants that we can apply, through the state. They have a system that, e-grams that we can apply for our grants on, which makes it, controversial. It does make it easier, but, it's like any new electronic system. There's always little bugs and people have questions and issues. But every year we do have a system down where we do apply for these grants. But there are some out there that are much more difficult to apply for, and that's always a challenge. You're right.
Go ahead, Judy.
Just recently, there were articles in the paper about a meth cooking outfit that was doing quite well. And aside from the possibility of blowing the house up and poisoning the baby, do you see the runoff from the production of meth? Or what do people do who get involved with things like that in this county?
Yeah, I haven't seen too many cases recently, but we have had some in the past. I've been here 6 years now, and I've seen one or two across my desk. The state of Illinois, their toxicology division, and I know the Illinois the police, the state police, and I know they have a lot to do with the cleaning up process, and cleaning up these houses is not an easy task.
No.
And but I do know and I'd say, but fortunately the state gets involved in all that. It's because it's such a technical thing, and our resources are pretty narrow, being a small local health department, but they do a good job with that. But we do see our share. There's meth labs all over the state, and
sure.
Logan County certainly is no exception.
That's right.
We've in the past we've visited with our law enforcement officials around here, and we're going to have the chief of police back soon here to discuss various things in the county. Not the least of which is our drug problem. Yeah. And as we all know, we've just recently hit the front pages and the back pages too. Yeah. With people involved in a meth lab here, not an infrequent condition in any county. Yeah. Or any small community. We'd like to think that we're insulated here because we know but we're not.
It is. And as a health department, right now we've identified a few areas that we're really working with, and we've partnered with the local hospital. They're just a wonderful partner. They do such an outstanding job in this community, and we're working with them every 3 years on a plan to address some of the major health issues in the community, and I know smoking is one of the issues with the teenagers, and because 21% of all teens in Logan County smoke, which is a little higher than the state average.
Really?
And we our health education through the reality program. We're working with the high schools right now, trying to get the kids off tobacco because it's a bad thing, and we're working with the kids that do not use tobacco, and we're using them to help promote non-smoking to the people that do smoke, to say, hey, look, you're one of the 21 percenters. We're one of the 79 percenters here. Why don't you be one of the 79 percenters? That's a major issue. And then especially, people that are pregnant that smoke. That's been identified as a major area in Logan County, especially when you're pregnant. That's the worst thing you could do, not only for yourself, but for the unborn child. And so we have a grant now, and we're going to have an intern working at our department, and she's going to be working with the community and some of the high schools in terms of promoting non-smoking, especially with people that are pregnant. So those are just some of the issues that we're looking at right now. And then, obviously, obesity and other things like that. So we've got a lot going on in the community.
We got kicked out of first place in the obesity run.
Yeah, and we're still pushing that.
Still right up there.
We have a program called Positive Actions Related to Youth that we work with. A lot of these we do in conjunction with the hospital, but it is a program geared towards junior high kids, and it basically teaches them not only good healthy living, but good overall practices in life. And they have a program coming up in March, which will be huge. And again, we just invite all the junior high kids, and there's usually about close to a dozen speakers that come and they talk about different aspects of health. So we're trying to do what we can, make an impact, especially with the younger generation. So as they get older, they can learn good habits, and they can teach that to their children.
Right.
In that respect, there's a lot of things. We realize immediately it's hard to address the meth issues and the mental health, but we do realize we have grant dollars, and we can do things with some of these other areas that we can really make an impact. So
you've highlighted lots of them.
Judy, I'm sitting here thinking,
I'm a highlight nut.
That's all right. He mentioned the smoking with young people. Mm-hmm. I guess I've had the ostrich syndrome. I've had my head in the sand on that. I did not realize that was a major problem with our young people.
Oh yeah. In Logan County, 21. The last I checked, it was 21%. I think statewide, it's somewhere around 19%, if my memory holds correct. So we're slightly higher than the state average.
A quick side comment. I didn't smoke when I was in the service, and we could buy, I forgot now what we could buy at the PX, a carton a week or something. I don't remember now, but anyway, I didn't smoke, so I'd save these cartons and I'd send them home to my mother and father, who were smokers, thinking I was doing them a favor.
Yeah.
Didn't have, totally naive about that.
Yeah.
And everybody thought we were doing a big favor for them.
Back in the day, that was it. And
Right. Nobody thought that it was.
You had a bridge
all
club.
The movie stars in the movies were smoking all the time.
Sure.
Yeah.
Well, and Bill, you served in the war, correct? In World War II, and that was a thing. Give your comrade a cigarette. And
why they had them in all the K rations and C rations. There were cigarette packets, little bitty ones,
Mm-hmm. Yeah.
3 or 4 cigarettes or whatever.
And I don't get a chance to say this too much, but knowing that you served our country, and I'd like to just say a big thank you to all the men and women that have served, that are veterans, and
particularly today.
Absolutely.
You see, today we do not have a conscriptive army or military, I should say, any of them. Those are all volunteers. And take a special tip of my hat to the volunteers. I'm not going to get into I'm just stepping on the line, but I'm awful close. But the movie 13 Days, 13 hours, I'm sorry. Volunteers. And it kind of reminds me of Ronnie Reagan when he said, "Where in the world do we get such men?"
Yeah.
And in this case, and women too, because we have some lady pilot pilots. That's incredible.
Yeah, that really is. But
so anyway, that's
but
another
the
time,
country wouldn't be the same. We wouldn't be what we are without the men and women that serve. So I just wanted to thank you for that.
Talking about smoking, the chemical cigarettes, people kind of turned to those because they were going to be, quote, healthy, unquote. How's that working?
Not well.
Well, there's been some studies out that show that there's actually more chemicals in those cigarettes than you'd think, and there's still more clinical studies that need to be done, but everything is pointing to the fact that they may not be as safe as people actually thought. And I think if I read in there's chemicals like, if I remember, formaldehyde and other type of chemicals that they've actually extracted out of those e-cigs. So, I guess the jury's still out on that, and we're, are they going to address that in non-smoking areas? I think the state, if I remember, and I'd have to go back and research, but they either are actually pushing for that or they have done that. But the bottom line is they are questionable, and we really do question the health of those, and we certainly don't advocate.
If you want to be really safe, just don't get involved with it.
Absolutely.
Don,
absolutely.
in your sphere of health care, has there been anything come down the pike regarding medicinal marijuana?
I do know. We have the facility here in town, and I do know that's
a grower here. They don't.
Yeah,
retail. They're the grower.
I've heard that therapeutic wise, it does have its benefits. I have not personally researched it enough to really say but I have heard if it's in a controlled situation that it does help, and it's more of a therapy, more for pain relief, and we may see more of that. I'm sure we will.
It's an income producer, let me tell you that. It's a big income producer.
There will be companies making a lot of dollars off that.
Oh yeah.
And we're as a local health agency, we promote positive living, we promote prevention, but we really don't. We're not really a promoter of different therapies and different things. That's we let the companies do all
basic
their own
health
promoting.
Is what your word.
Yeah, we want people to live right, not to smoke, to eat food that's safe. To make sure the community's protected. So that's, as public health, that's really our primary goal, is prevent, promote, and protect.
Before we close, Don, and we're pushing that line again, we got to fix that clock, Mr. Ash. Logan County Public Health Department, you have how many associates there?
We're right around 34.
And you're covering, if you please, the gamut of what spheres of health are you covering our citizens in Logan County?
Well, we have our Women, Infant, Children program, or WIC program, which is works with young children and nutrition, and then and the maternity and the child program and the pregnancy program. We work with people who are pregnant and nutrition. We promote breastfeeding. We also have a HealthWorks program. We're a lead agency for 12 other counties, which HealthWorks is a program that works with foster children. And within the 12 counties, we have about 1,200 kids that are in this program. And it's a program we link children to that are in foster care to a physician, so they have ongoing medical care while they're in the custody of the state. We've talked about our home health. We do food sanitation, water safety. Matter of fact, I've put out arsenic alerts, some of the water wells, especially where we're sitting here, and in this side of Interstate 55 near Atlanta, we found that in some of the local wells there's arsenic in the water, and I've sent notifications. I've sent notifications out to the people that within a radius of where we found that, but I've also put out press releases. I'll use this as a good time to remind people, if you're especially in this area near Atlanta and you're on a water well, you may want to have your water tested for arsenic. Go to our website, WLCDPH.org, and under our water page and environmental health, we've got all the information on arsenic. So I really want to urge people to look out for that. Obviously, and our dental program, which is just a wonderful program. Looking forward to primary care coming down the pike.
Wonderful.
So we've got a lot of different areas that, we serve the public in. Obviously, our clinic, and we do screenings and immunizations. If anybody wants more information, you can go to our website, which is a great 24-hour resource for people. And, and I do want to remind people, too, Bill and Judy, that the Health Expo, which was formerly called the Community Health Fair, will be coming up. And
soon.
Yeah, that is February 20th. Is the Saturday the 20th, which is the community event.
Right.
So we're real
At
excited
the rec
about
again?
that. I believe so, yep. At the rec center. And the reason they moved it a little earlier in the year is because I think we did it at the end of March last year, and the weather was 60 degrees and sunny out, and
people wanted to go
be
play
out in the good weather. Yeah, so it'll be a little colder, I would think, around February 20th. So hopefully we'll get, we had a good turnout last year, but we're hoping to bring more people in for that too. So
well, it exposes the county to the many services available out there. Our guest this morning has been Don Cavi. We call him the major domo, for want of a better title, of our Logan County Health Department out there on 3rd Street. A service about which many people are really not aware of, or certainly have minimal knowledge of. Doing a great job for us out there.
Thank you very much.
You've taken some time out of a very busy schedule, hooked up the dogs, and you were able to make it up here okay this morning.
Well, I appreciate that, and it wouldn't be possible without the great staff we have. So really, they're the ones that are there where the rubber hits the road, and I really have to give them all the credit. And but it's always a pleasure to be on with you. I really enjoy our visits.
Well, we thank you very much. I always try to close with a quote, and I found one that certainly is analogous to our Logan County Health Department. It's Ted Kennedy, of all people, came up with this. We cannot reform health care without resolving the problem of access to care. We have access to care here with our Logan County Health Department. Thank you, Don Cavi, very much, sir.
Well, thank you very much.